over the weekend, people over 80 have been added to the priority list. When do you expect them, based on what you know about current supply, incoming supply, when do you expect, let's say, people watching who are over 80 in Ontario to be able to access a vaccine?
Well, Vashi, first, just let me talk through where we go quite literally from here today or this week when the next Pfizer arrives. And what we want to do is get back to the long-term care homes and the higher risk retirement homes and the elder care facilities around Ontario, get those second needles into the residents so they have the immunization program complete, pick up the essential care workers or healthcare workers or staff who work there who have not perhaps yet had a first needle, and if they have, get them their second needle. Secondly, we want to kind of restart, I think is the way to describe it, giving the vaccination to those high risk and higher risk healthcare workers. That is to say, those patient-facing healthcare workers, to get them that level of protection that we desperately want to get them. And of course, we want, in conjunction with the regional chiefs, to be able to roll into the highest priority communities, those that are stratified by the leadership themselves in the First Nation across Ontario. And so we're doing that quite literally right now. We're going to make sure that we get a maximum number of needles into our arms. We're going to keep our extension of the days between needles for Pfizer, and we're still aiming at 35 days. That gives us an opportunity to get more needles into more original arms. And secondly, we're not going to keep our second dose in the freezer. You know, the Prime Minister has said the vaccines are on the way. We're going to take him at his word. And as long as we can see the next shipment arriving next week, we're going to put the doses that we have now into our arms as rapidly as we can. And if we do that, by the first week in March, we're going to be able to start with 80-year-olds who have not already been vaccinated because they've been in a long-term care home or a retirement home. And we've probably picked up 10% of the population of more than 600,000 who are 80 years old and higher in the province of Ontario already. So I see about the first week in March, we will be starting into vaccinating those who are not in those homes, those who are 80 years old or older who don't already have a vaccination.
So just so I'm clear, you're going to go for second doses in long-term care homes prior to opening it up to the more general population outside of those homes over 80. Is that accurate?
And that is accurate, Vashi. In fact, we have to. We don't want to fall outside of that 42-day period for sure. And we want to make sure the immunization is actually complete. So yes, we are going to do that. And then as we see it and judge it, we'll know when we've got some vaccines to go into the next set of arms, and that will be those 80-year-olds. And I venture it will be around the first week of March that we'll be able to start that.
Okay, and then following from that, for, again, those people watching right now who are in that age group and wondering how in the first week of March is that going to happen? Is it going to, like, is it an appointment? Is it through a family doctor? What are the plans for how the more general population gets immunized?
First of all, Vashi, we're continuing to finalize those, and part of what we've been doing since the drought is working with the public health units and our IT to make sure that that occurs, so that we are planned, we are prepared for that. So all of the above is what I would say to you. We'll roll out in the next week and a half or so a call center where people who are not used to going online can call and reserve an appointment in a place close to them based on their HOIP card and their postal code, for example. And then on or about the 1st of March, we're going to roll out an online reservation, pre-registration and reservation system to do exactly that. So they should be prepared to do it that way. We'll roll out the vaccine for them in mass vaccination centers, with family care providers who probably could come together to do mini vaccination centers themselves. That would be the most efficient way. And through pharmacies themselves. The part of that population that will be difficult to get at, but we will, and we'll figure it out, are those that have to stay in their own homes and are not mobile to come out. And as you know, it's difficult to move Pfizer, it's difficult to move Moderna by one syringe at a time, and clearly we don't want to waste it. So we got that part to figure out yet. But yeah, that's how they'll get it. We'll have a call center, we'll have online registration, and I would just commend to community groups and church groups and people who are in support of the population like that, reach out to them and help them when those things are announced and when they go live and when they're online. Reach out to them and help them walk through this process if they're not comfortable doing it itself.